Robyn Flynn filling in for Elias Makos. Syphilis cases have more than doubled in recent years. Yeah, you heard that right, doubled. And HIV cases have gone up as well. A Montreal-based group is going to be conducting trials across Canada to evaluate this trend and try and provide some more insight. Here to chat a little bit more about that is Dr. Marina Klein, professor of medicine at McGill University Health Centre and director of the Canadian HIV Trials Network. Good morning, Dr. Klein. How are you?
Good morning. I'm very well. Thank you.
So I mentioned syphilis cases doubling in recent years. I think when people hear syphilis, they think of, an STD from hundreds of years ago. They don't think about this as a modern STD or STI. So, how big of an increase are we actually talking about here?
We're talking about a quite substantial increase right across the country. Some of this increase has really been concentrated in the western provinces. But here in Quebec, here in Montreal, we've seen rising rates as well, almost doubling from, say, for example, about 400 cases to almost 900 cases in 2022 in Montreal.
Wow. I wonder, I don't know how much information you have about the kinds of cases and who is actually contracting syphilis right now, but I feel like I've been reading a lot of information in recent years about how young people are having less unprotected sex. So are we seeing these cases in young people, which is, I think, traditionally the demographic where we saw the most STDs, but I feel like maybe older people are probably contributing to this as well?
We see it actually right across the age spectrum, so I think that's really important to remember, so that anybody could be at risk. Anyone who's having sex can be at risk for acquiring these infections. It's true that most of them are concentrated, particularly among particularly men between the ages of 25 and 40. And unfortunately, disturbingly, the shift is in a younger female population between the ages of 15 and 30. So why that's important is because syphilis in particularly can be transmitted to the unborn babies and lead to something called congenital syphilis, which have been, essentially eradicated in Canada. And unfortunately, we're starting to see cases again now in the last few years.
In conversation with Dr. Marina Klein, professor of medicine at the MUHC and director of the Canadian HIV Trials Network, chatting about an increase in syphilis cases in recent years. HIV cases are on the rise as well. Is there a reason why we are seeing an increase so drastic? I mean, a doubling in recent years. I mean, sex education is still there. Access to prophylactics is still there. What has changed?
Well, I think there's, like anything that's like this can be complex. There's many reasons. I think, part of it is that we've had successes, right? Successes with treating HIV infection so that people who are treated and their virus is suppressed can't transmit the virus, and successes in how to prevent HIV. And this has sort of led to a decrease in fear around the infection, a decrease in condom use, and of course, although these interventions for HIV work to prevent HIV transmission, they don't prevent transmission of other sexually transmitted diseases. But there's also, other factors that are going on at the same time. We've heard a lot about the opioid crisis, about drug use related to sexual activities, and that kind of leads to people taking many more risks. And then there was the effect of the COVID pandemic. We know that rates of these infections sort of declined during that time, but it wasn't really because they were truly not going on. It was because they were being undiagnosed. So people didn't present to be tested. They didn't present to be treated. And so that allowed, more transmission to be happening. And we're starting to see the impacts of that now that people are, back out and in public and socializing.
So what can be done to get these numbers back under control? I mean, it feels fairly obvious. I don't know at this point, like, do people not realize how to have safe sex? I feel like this has been hammered into us for decades at this point.
You're right. Well, as you're right, education is important. I think sensitizing to people to the fact that these infections are increasing, are out there, and that anybody who's engaging in unprotected sex could be at risk. Traditionally we think to pigeonhole people into, oh no, it's only people, for example, men who have sex with men who are at most risk. But now we're seeing this generalized much more in the population. prevention is available, but I think one of the things that can be done to prevent is really to get screened, to get tested. And there's still a lot of stigma around having a sexually transmitted infection. I think people are afraid to come forward often to get tested. There are good clinics in the city, actually, where you can go free of charge to be tested and even quite anonymously be tested. There's a clinic called Très Libre where you can kind of self-test and then get your results and be treated. So if you do early treatment, we can prevent transmission to others. Some exciting new things that we're looking at are ways to prevent these infections, and these are some of the clinical trials we'll be conducting through our network. One is looking at something that you may have heard about called doxy-PEP, which has been use of an antibiotic sort of as a morning after pill, and that can really help reduce the number of these cases. And we're looking at other preventive measures in a clinical trial.
Very interesting. Worth mentioning as well that I think a lot of the time when people hear the term safe sex, they think about preventing pregnancy. And a lot of the options that we have for preventing pregnancy, like birth control pills or IUDs, stuff like that, those do not protect you from STDs, right, Dr. Klein? That's
totally correct. And, the age-old condom is really the best overall protective apparatus we have to prevent all sexually transmitted infections, including HIV. I think there's been sort of a trend towards, not wanting to use condoms in sexual relationships over the last couple of years, especially with this less fear about HIV. And I think, fear should not be a motivator when it comes to these infections. I think we can make very educated decisions about how we engage with partners we don't know, or who, you can get tested, both before you engage in a relationship is another way, and then not use condoms potentially. But there's ways to approach this with thought and care, and to protect yourself and to protect your partners.
Dr. Marina Klein, Professor of Medicine at McGill University Health Centre and Director of the Canadian HIV Trials Network. Thank you so much for your time today, Dr. Klein. Really appreciate it.
Oh, it's been my pleasure. Thank you.